Elena. How are you doing? Good, thanks. I know the nurses prior that came in were kind of started talking about treatment options. So myself and Miranda here are going to just talk about the treatments in more depth. So right now you have hepatitis B in the acute phase, so there's not really any treatment. We just focus on management of the symptoms such as comfort and nutrition and that sort of thing. Overall, hepatitis B has no cure, so if it goes on to the chronic disease, we treat that with antiviral medication. And why it does not cure it, it suppresses the replication of the virus in your body. So the progression of the disease will slow down, and you can live as normal life as possible.
So how do I know if it's chronic?
You'll have, well, chronic is longer than 6 months. So we'll continue monitoring you. You'll have blood tests and you'll have regular doctor visits scheduled. So we'll just keep an eye on that. And then if it becomes chronic, some two complications that could be a potential problem is cirrhosis of the liver, which is liver damage, and it's not reversible from scarring of the liver, and liver cancer. But those would be could take up to 20 years to develop, and they don't always develop. So if that does occur, then we'll handle that when that happens.
So I could live for a long time with this and be okay.
Right. So right now we're just going to focus on keeping you comfortable and maintaining normal life.
Okay.
So I went ahead and looked at your chart, and I saw that you have children and you're married, correct?
Mm-hmm.
Do your children, have they gotten the hepatitis B vaccine?
No, because I never did, so I just didn't vaccinate them.
Well, the vaccine is the best way to prevent getting hepatitis B, and we recommend that all infants get it, anyone under the age of 19, anyone that's having sex with someone that may be positive, or just having unprotected sex in general, or that may be exposed to the virus, like healthcare workers or public safety workers. So we would definitely want your children to be vaccinated, as well as your husband, since you are positive for it, and we would not want it to spread to him. If other ways that we can prevent it are by not sharing needles, by using a condom every time we have sex, and that's about it.
So if my kids aren't infants anymore, can they still get the vaccine?
They still can get the vaccine, yes. We would like to get it as soon as possible, just to take that preventative measure. The vaccine usually comes with 3 different intramuscular injections. You'll get the first one, then you'll wait about a month later and you'll get your second one, and then about 6 months after that you'll get your third. Now, if after the first one you wait a little bit too long or the schedule is just a little bit off, that's okay. We just want you to get the second one as soon as possible. And then the main guideline to follow is after the second injection, at least 8 weeks need to pass before getting the third one. So it's okay if it's not exactly 1 month, 6 months, but we need to keep it within those guidelines.
So that's probably the best option for my kids.
Right. Yep.
Okay. Well, thank you guys.
Thank
Do you have any questions?
I don't think so at this point.
Okay, thanks.